Good morning. This is David Henry. I'm the Communications Manager at the City of Amarillo. Welcome to today's weekly COVID-19 broadcast for the latest in COVID-19 information for the Amarillo community. Once again, we do these every Wednesday at 11 a.m. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Pro Tem Howard Smith, Casie Stoughton, Public Health Director, City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for Baptist St. Anthony's, Dr. Rodney Gonzalez, Director of the Amarillo VA, and Amarillo City Manager Jared Miller. We'll turn it over to our panel to make some brief opening statements, and then we'll take questions from our media. We'll go ahead and start with Mayor Pro Tem Howard Smith. Mayor Pro Tem, how are you this morning?
I'm very good. Thank you. As Mayor Pro Tem, I am subbing for Mayor Nelson, who couldn't be here today. I've attended many of these meetings, most, not all, I missed some, but I appreciate very much you people all participating in this. I think it's important to get the message on what's happening with this COVID out to the community. And I get a lot of comments saying they see it and the public appreciates it also. I want to ask you participants in this to do something, not just for me, but for the city council and for the city. As you go back to your respective facilities, would you tell the doctors and nurses that work directly with people that have this disease, thank them, the city thanks them for what they're doing. I understand there's some risk in what they do, but they're doing a great job and we appreciate it. So if you'd relay that to them, I'd appreciate it. That's all I have to say.
Thank you, Howard. We appreciate it. Let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you this morning?
I'm good. Thank you, Dave. It's good to be here again this week. So I have a lot of information this morning. So I want to share all of it with you. So bear with me this morning. As of yesterday, there were a total of 6,913 cases of COVID-19 in Potter and Randall counties. 4,398 in Potter County and 2,515 in Randall County. That is an increase in 378 cases since last Tuesday. So we are seeing quite an increase in cases. We have a total of 6,036 recoveries, and we do have an increase to 92 total deaths reported in Potter and Randall County. We're so, our hearts are so saddened by each of the deaths, and we just want to reach out to each of the families and communicate our condolences. That leaves us with a total of 785 active cases. Each of the cases do represent a unique individual. The school dashboard that we talked about last week is almost ready. And so until that time, I do have an update on school numbers. AISD has a total of 112 cases with 62 recoveries. Canyon ISD has a total of 33 cases with 13 recoveries. Highland Park ISD has a total of 3 cases with 0 recoveries, and that doesn't mean that there are no recoveries or that there was a poor outcome. It's just that all 3 of those cases are still under quarantine. River Road ISD has 11 cases with 6 recoveries. Bushland has reported 1 case, and that case is still in quarantine. And the private schools, collectively, there's a total of 26 cases with 18 recoveries. And so until the dashboard is up and ready, we'll be providing that information to you. The rolling 7-day positivity rate for Potter Randall County is slightly down from last week. It's currently at 12.66%. And the positivity rate at the drive-through testing site is also down just a little bit, and that is at 26%. The public health drive-through does remain operational, and you can call 378-6300, and our call takers will screen and direct you to the testing site. If you do test positive, we just want to give you a little bit of information. Please stay home and away from others inside your home for a minimum of 10 days, unless you need to seek medical care. Public health staff will call you, but we want to make sure that you know to stay home and to stay away from others. If you're exposed to someone who is positive, then we also need you to stay home for a minimum of 14 days from the last time you saw that person. We understand that those times are a little different, but it's important that you do that to protect your family, yourself, and others. As we continue to see an increase in positive cases, we do want to remind everyone that prevention is key here. Wearing masks, distancing ourselves from others, again, 6 feet is a good rule of thumb. Good hand washing and staying home if you feel sick, again, unless you need to seek medical care, remain our tools in the fight against COVID. We do look forward to a time when we have a COVID vaccine. Until then, get your flu shot. I got mine this week. Pamela at the Walmart on Coulter did a great job. So if you haven't gotten your flu shot yet, now's the time. And that's all I have today, Dave. Thank you so much.
Thank you, Casie. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good, Dave. How are you?
I'm good, thank you.
Good. I wanted to thank Mayor Pro Tem Smith for those words, and Casie as well. I think she said it very well. I want to spend a little time once again on the important topic of wearing a mask. You know, masking it protects your neighbors and those that are vulnerable to becoming quite ill from this disease. It's important, obviously, to practice social distancing. I do not view this mandate as a political. I view this as part of being a good citizen. Now, as Dr. Weis and Dr. Lamentier will talk about in a minute, our hospital numbers continue to rise with individuals that are sick and sometimes dying of COVID, not just with COVID. I've been asked that question more than once. Do they just happen to have COVID and they died of something else? No, these individuals are dying of this illness, and they would not be in the hospital if they did not have and were not sick with COVID. So please continue to comply with masking and distancing as much as possible. And that's all I have, Dave. Thank you.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
I'm doing well. I apologize. I'm having to beam in from another location this morning. We've had some kind of disruption of the signal from our internet provider at the hospital. I suspect that a cow was standing on the transmission line this morning. Anyway, over the last couple of months, we have heard a lot about the responsibilities and challenges of different people in the healthcare setting. So we've heard a lot about nurses, obviously physicians. I want to focus on a group that is truly the unsung heroes today, and that is our environmental service or EVS workers. These are the folks that keep our hospital clean and disinfected. And this is extremely difficult work. It is thankless work. And yet their work is critical to basically keeping us, the fellow staff members, visitors, and the patients safe in our hospitals. Anyone that's worked in a hospital knows a hospital is not a safe place. Hospitals are full of bad infections, and now COVID-19 is just yet another one on that list of common culprits and suspects. So these EVS workers are our stormtroopers. They are our firefighters and preventing these infections. So it is EVS week this week. I think they should get a whole month, but it is EVS week. So please thank these folks in our hospital for the work they do. I want to personally thank our staff and staffs of all healthcare facilities in EVS for the incredible work they do at keeping us all safe. Now to turn to our numbers. So we have 23 positives today in Northwest. That is down from 31 last week. We have 12 in the MICU with seven on ventilators, and 16 of our 40 ventilators are currently in use. I do want to also talk about what Dr. Milton said, which is part of the reason our numbers are down from last week is we've had some deaths at the hospital. And these people are dying of respiratory failure. It is being caused by the virus. It is obvious to us that work with these patients that that they are dying from the effects of this virus on their lungs in the ICU. So yes, they may have comorbidities, but this virus is what is ultimately getting to them. Currently, so as Dr. Milton said, we have seen an uptick in positives in the hospital and outpatient testing after Labor Day, after schools are opening. Thankfully, right now, we do not have any pediatric positive cases in the hospital. In terms of testing, we continue to move to the antigen testing, which is that faster turnaround testing, and we seem to be able to get better amounts of supplies for that. So currently, we are testing all admissions to the hospital, and we're testing everyone who's getting a procedure in the hospital. So that is critical because we are seeing staff still becoming positive. So to protect our staff, to protect fellow patients, we are testing all admissions, all people receiving procedures in the hospital. In terms of remdesivir, which is the drug we've been using, right now we have 10 patients on remdesivir in the hospital. We have enough to treat another 70 plus patients as needed, and we have treated a total of 113 to this date. And then lastly, I just want to emphasize what Casie said, which is flu shots. Okay, absolutely critical. The only contraindications to flu shots is for infants less than 6 months old and people who have had a severe reaction to previous flu shots, meaning anaphylaxis or that stuff. So if you don't fall into one of those two categories, you need to get a flu shot, and it helps protect you from the flu and the combination of flu and COVID this year. So, and I do want to thank Mr. Smith for his comments. We will certainly take that back to our hospital. So that's all I have this morning. Thank you.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
I'm doing well. Good morning, everybody, and thanks for having me on again today. I'll start off with our numbers today and echo what's been said by Dr. Milton and Dr. Weis, and that is that we are absolutely on an uptick here, it appears, in the community again in terms of cases. Casie mentioned that, and the hospitals are seeing that. We have 35 patients today that are confirmed with COVID positivity. We have an additional 5 that are under investigation now. We had 36 patients yesterday that were confirmed. Of those 35 that are in the hospital, currently and confirmed, 18 are in the ICU, and of those 18, 6 are requiring the ventilator at this time. We're using a lot of high flow nasal cannula oxygen on patients that are not going on the ventilator in attempts to stave off that intervention. But when it's necessary, those patients, as we mentioned, will end up on mechanical support. There's no question that the severity of COVID infection is leading to mortalities for some of our hospitalized patients, unfortunately. And those patients that have other chronic illnesses are higher risk for having a more severe complication. But it is COVID, as Dr. Milton mentioned, that is causing the death of these patients that otherwise possibly would recover. For instance, if they had a bacterial pneumonia that was sensitive to an antibiotic we were giving, some of those patients would survive. We don't have that type of treatment yet for COVID-19, where we're confident that something is going to eradicate the organism. So again, this is a serious illness. I was looking at the demographics across the public health department's scorecard on Monday, and then looking at our internal hospital demographics. And it is consistent, and we know this already, but I'm going to reiterate it, that the ages that we're seeing that are most frequently being infected appear to be younger folks. About 40% of our patients community-wide outside of the hospital, if you will, if you look at the entire cohort, are in their 20 to 30s, those decades of life. A third are in their 40s and 50s, and about 17% are age 60 and older, those that have been infected. But when you change that paradigm now and look at the patients that are hospitalized, it's a different cohort. So let me give you these numbers at BSA at least. As of the beginning of this week, 49% of our patients that were admitted were age 70 and older. A third, 33%, were between the ages of 50 and 69, and 18% were less than age 50. So that shows that the older patient population is a greater propensity for being admitted, but it also shows that we have young patients that are admitted. And we've also told you several weeks now in a row, at least, that we're getting occasional pediatric patients that require admission and that have serious respiratory affliction as a result of COVID. So again, it just gives you a little bit of an idea of the landscape we're seeing in the hospital as compared to what it looks like in the community at large. So far, we have now done over 9,200 tests for COVID since the outset of the pandemic. We're continuing to run in that range of about 17 to 18% positivity of all the tests we've done, inpatient and outpatient. Our preoperative testing, we've done over 3,000 preoperative tests. And of those, we still continue to have a less than 1% positivity rate, which means that those patients that are asymptomatic coming for procedures that end up testing positively with our protocol, very few of them are testing positively. When they do test positively, we have the surgeon determine whether or not that procedure can be delayed, and obviously attempt to have that rescheduled at a time when they are recovered. That is a decision that we have to make carefully depending upon what the procedure is and its necessity. I want to make sure we emphasize, as all of our clinicians have today, that it's critical to get your flu shot. I got my flu shot last week. For those of you that need and qualify for the pneumonia shot, you should get that. Mostly those are people that are 65 and older, those that have comorbidities, even younger than that age. And again, that can help to prevent the most common types of pneumonia from a specific organism, if you will. And I also want to reiterate, do not be afraid to get routine medical care. It's critical that you're maintaining your routine appointments, whether it be in person, whether it be virtual, screening tests that need to be done from health maintenance perspectives, not just immunizations, which are critical for this illness, but making sure that you're keeping your appointments for other interventions that are necessary. It would be very, very much a shame if we missed a diagnosis that was significant because someone chose to, forego their colonoscopy, if you will, and they have a high risk scenario because of their family history, those types of things. So please make sure you're making good decisions about routine health care. Lastly, remdesivir. We have treated 109 patients in the hospital so far. We're following the expanded guidelines from the FDA on emergency use of that drug. We are also continuing with judicious use of dexamethasone and steroid treatment, which has been shown to give some benefit to patients that are having severe disease. And we have 12 patients now that have been enrolled in the Regeneron trial, which is looking at a monoclonal antibody that's attacking the spike protein on the coronavirus. So far, 12 patients enrolled, and we'll continue to work with our physicians and team that are doing that investigation. And I guess the final thing I should say is, echoing Dr. Weis's comments, it's EVS week, and our EVS environmental services staff are some of the heroes in our facility. They have a very difficult job, and they do it very well. And they do it with a smile on their face because they're hardworking individuals, and we appreciate them very much. We would not have the facilities that we have today and the quality and shape that they're in without their hard work. So thank you very much. And I'd like to thank the panel today for allowing me to share some of BSA's data.
Thank you, Dr. Lamentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, good morning.
Good morning. Thank you for this opportunity. First, I'll hit our numbers here at the Amarillo VA. Currently, we have 3 inpatients, only one of which is in the ICU with COVID positive. We have 21 veterans that are home self-quarantining that we are also monitoring. We do not have any PUIs. As mentioned by the many panelists before me, would like to encourage everyone with their flu vaccination for our veterans here in Amarillo. We will be doing our flu fair drive up for here on campus Monday, September 28th through Saturday, October 3rd. And so for veterans who cannot make that time, please remember you can still get it at the primary care clinic. We are continuing to vaccinate. I myself was vaccinated about a week and a half ago. I want to thank, as we mentioned last week, this is Suicide Prevention Month, and we had our first suicide prevention and mental health, behavioral health program town hall with our veterans, and we had over 500 veterans participate last night. And so while we know Suicide Prevention Month is September, we know every day is an opportunity to prevent suicide. And last, I want to mention this Friday, we have 2 big days coming up. We have the Air Force birthday. And while I know we have a little inter-service rivalries and enjoy that, that being said, is the Air Force going to celebrate 73 years of being the greatest Air Force the world has seen is our United States Air Force. And so want to thank our Air Force veterans out there. Also, Friday is POW MIA Day, a time to remember our former POWs. I got the histories of about 8 former POWs in the Texas Panhandle this week, and my team told me about that we service, and so that we take care of. But at the same time, it's a time to remember those missing in action from World War II, Korean War, Vietnam, and many others, Army, Navy, Air Force, Marines that are missing or were taken prisoner of war. Once again, I'd like to thank you, the City of Amarillo, for this opportunity. I'd like to thank our staff, and I echo our environmental services do great jobs. I will tell you is I have seen many times where they are called upon, and because we have our outlying clinics, is that sometimes we have to send a team to one of those outlying clinics, and they go without fail to take care of our hospital. So thank you for this time, and have a great day.
Thank you, Dr. Gonzalez. Now I'll go to City Manager Jared Miller. Mr. Miller, how are you this morning?
Doing good, Dave. Thanks. As always, I want to high five Dr. Gonzalez. Great comments regarding our servicemen and women, and especially on the anniversary of the Air Force. I want to just piggyback on what Casie said earlier and remind everyone that the drive-through testing center remains open. If you feel sick, you have symptoms you think might be COVID, call the public health hotline at 378-6300 to be screened for the drive-through testing center. We continue to be under Executive Orders GA-28 and GA-29. We have been in contact with the governor just last week and into this week, and with the governor's office to share some particulars about our experience and some uniqueness with regard to things that we might need from them. We anticipate at some point in the near future some modifications to the current orders that might provide a little more flexibility depending on experience, but we don't know that yet. And we don't know exactly when that's going to happen. They're going to do that when it's appropriate. We do know that they are working very diligently to make sure that the orders that they have across the state are appropriate. And so they're working on that. And I just want to encourage people about that. With regard to GA-28, there are no occupancy limits on essential critical infrastructure, religious services, local government operations, childcare services, youth camps, or recreational sports programs for youth or adults. There's a 50% occupancy limits on outdoor areas, events, establishments for professional, collegiate, or similar sporting events, amusement parks, water parks, museums, zoos, aquariums, and rodeos and equestrian events. There's also a 50% occupancy limit on all other commercial businesses. With regard to GA-29, this is executive order of the governor, standalone executive order of the governor dealing with face coverings and requiring face coverings anytime someone's inside a commercial entity or other building or space open to the public. There are some exceptions to those, but the lion's share of people out and about should be wearing a mask per executive order GA-29 from the governor. That's all I have, Dave. If there's any questions, I'll be happy to answer them.
Thank you, Jared. We'll now go to members of our media. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of News Channel 10, KFDA. Kevin, how are you this morning?
Good, thanks. Casie, can you just pin down a little bit what's been happening to increase the number of active cases over the last few days?
Sure. So, I think anytime that we gather in groups, the risk of spreading COVID increases. And so as school is certainly in full force, as we're just a couple weeks out from Labor Day celebrations, I think that we're seeing increases in cases from both of those scenarios.
Okay, thank you. And can backtrack just a little bit. You mentioned a 12.6% positivity rate. What does that refer to? I'm sorry.
So Sure, that's a rolling 7-day average for the positivity rate here in Potter Randall County. And I misspoke, that's actually up. I believe last week it was around 10%. So it's actually up just a little bit.
Okay. And also for Casie, how is the city able to keep up with its contact tracing and monitoring of positive cases? That's a lot of people.
It is a lot of people. So we, I certainly appreciate the support from city council and city management. We've had the flexibility to increase our temporary staffing as needed. And so we've hired an additional probably 12 or 13 nurses and contact investigators to do this work. And so as they are, certainly there's a little bit of a learning curve. And so they're in the process of that training, but they will be, many of them are independent now, and we're working through those cases.
Okay, that's what I got. Thank you.
Thank you, Kevin. Let's now go to David Gay of the Amarillo Globe News. David, how are you this morning? Good morning, David. How are you?
I'm good. Good morning, everybody. I guess my first question would be for Casie. On the school numbers, can you tell me a little bit about has that increased over the past week or so, or what are the trends on those numbers from when school started initially to where they are now?
Yes, again, as we mentioned just a moment ago, as we are in groups, the risk of exposure certainly increases. And so we anticipate as school opened that we would see cases. And so we're certainly seeing an increase. And as schools are open longer, the number of cases is increasing.
Absolutely. And I know you said that city public health officials are still working on that education dashboard. Is there a date in mind to when that may be ready?
I don't have an exact date. They're still working on the programming pieces of that, the coding and the data entry, but I don't anticipate that it'll be too long.
Absolutely. And I guess the last question I have is for Mr. Miller. You said that you brought some concerns up to the governor's office regarding the executive orders. Can you go into any more detail about some of those things that you mentioned to the governor's office, some of the concerns that you have with the current executive orders?
Well, we've been working very closely with the governor's office, especially through the surges that we saw with the meatpacking plants and the time immediately after that when we had the CDC and state personnel here to assist us. So we want to make sure that everything we do is consistent with the governor's orders. So we were seeking clarification as we move forward with city activities and things that we're doing. We also wanted to share some of the unique experiences that we have as we go through school and other things and see if there's some openness to flexibility or modifying the orders where it would allow us to take steps that are appropriate to our experience while allowing possibly more aggressive steps in other areas where they have a much more significant experience than what we're getting. It wasn't to ask for any specific solution or any specific thing, just to get an update and continue having those open lines of communication. So they were very gracious in that, and they did indicate that they're looking at options, and they'll be looking to roll some of those out in the near future. But we did not have a date, nor is there any commitment.
Absolutely. That's all the questions I have. Thank you, panel. Thank you, Dave.
Hey, David, real quick, just go back to something that Dave just asked about, this testing. And I want to get the opinion of maybe some of the other people on the panel. We are seeing an increased number of people, as Casie mentioned, being exposed to groups, coming into the ER going and say, hey, someone just coughed on me 15 minutes ago. Can I get tested? And that's probably not a judicious use of testing. I've been asking some experts as to, okay, if you get exposed, how long should you wait before you get tested to optimize the chances of you knowing if you're true positive or negative? I've heard 3 to 5 days, certainly no less than 3 days. I heard another doctor say 8 days. But I definitely want to get the panel's opinion as to what are our recommendations for someone has a suspected exposure. How long should they wait before they actually come to get tested to try to confirm their positive or negative status?
So at Public Health, we generally recommend that if someone has been exposed, if they're in quarantine, we generally recommend that they be tested upon symptom onset. And that allows for that test, like you said, a good use of testing. Because if they test negative, then that might give them a false sense of security. When several days later, if they start to show symptoms, then that negative test may have given them a false sense of security. And so we generally, if someone is in quarantine, we generally recommend that they be tested upon signs and symptoms starting. But there may certainly be other opinions.
I'll comment. I think that's a good strategy, and I think Dr. Weis would agree, and I know Dr. Milton would, that trying to really focus the testing on individuals who are symptomatic, number one, conserves the appropriate testing. Number two, still allows us to test broadly for people that are symptomatic. And the only other scenario that I would say where we have at BSA tested some asymptomatic individuals would be a critical healthcare worker that we feel like had a potentially significant exposure, and we're contemplating reinstituting them back into the workforce prior to the maximal recommended duration of quarantine. And therefore, we would not test that individual for at least 3 days, as Dr. Weis mentioned. And again, our experience for folks that have been exposed, if they were not wearing proper PPE in terms of the conversion time frame, really has been in that 3 to 5 day window. So I don't think it's too early to test at that point. But again, we really should rely on a strategy where we have symptoms. And quite frankly, as we have mentioned, I think several of us on this call, we should be trying to get those tests done at sites like the city site, our healthcare facilities that are urgent care centers and ambulatory sites, and trying not to come to the hospital when you're not having significant symptomatology that potentially warrants admission.
I think those are great words. I had one more addition to that. I think the other thing that's really important to keep in mind is quarantining yourself. If you know that you've been exposed, as busy as the health department is, they're working overtime to try to get in touch with you to give you further instructions. But take these as instructions now. If you know you've been exposed, you need to isolate yourself. You need to quarantine yourself. And as these other doctors have said, it doesn't make sense to me to test right away. That's going to take several days before I think the test would be reliable. And the usual course of events is from the time of exposure to the time of developing symptoms is somewhere around 5 to 7 days. And that seems to be fairly uniform. But certainly people could be tested prior to that and be positive. But what we would recommend is the same. You need to be quarantined. You need to practice social distancing so you don't spread it in the community, because we know that there's so many people that are asymptomatic and that are potentially contagious.
Thank you, doctors. Good information. Let's now go to, if I'm not mistaken, we have Aaron Langston of KAMR Channel 4. Aaron, how are you this morning?
Pretty good. How are you all?
Good.
First question is for Dr. Weis. Is Northwest seeing similar age range numbers as Dr. Lamentier mentioned earlier?
Yes, I'd say absolutely. His numbers really rang true. I couldn't get the exact numbers, but I do want to stress the point, as he mentioned, which is we are seeing young people getting very sick. I can tell you right now, we have actually a member of our staff in the ICU who's a young man who's very sick. So yes, obviously we're seeing more admissions in very elderly and also some from nursing facilities, but the age range is across the board as to who's being affected by this virus.
Okay, and what you just said leads me to my next one. Are both hospitals still seeing a fair number of staff having to be quarantined or testing positive?
I would say, just to answer, less in the last
Go ahead.
week. But yeah, we are still seeing positives coming out of our staff. Yes.
We have right now about 20, we've been ranging anywhere from around 15 to 25, depending on the day, staff that are quarantined. And a minority of those are nursing staff, somewhere around that 8 to 10 number. And yes, we've had some staff members that have been infected as a result of workplace exposures, but the majority of our staff that have been infected have been from community exposures. The breakdown was something like 80 to 85% were community exposures versus 15 to 20% being workplace. And we have not had scenarios where someone's become infected that has been wearing the appropriate PPE. And that doesn't mean that our staff are not following our guidelines. They are. What it means is that there are times when someone is either tested negative initially, so it didn't have on a full spectrum of PPE because it wasn't our requirement for certain types of patients that ruled out and then tested positive later. Or they were rushing to assist a patient who was in dire straits and didn't have all of the appropriate gear on. The basics were on, but not the full gamut. So again, I just want to stress that when folks are wearing the full PPE recommended, the risk of transmission and infection of staff is very low.
Yes, and to add further to that, as we've talked about many times before here on this, the hospitals are safer than the community, and there's no accident about that, right? It's because we're requiring everybody to mask and everybody to use the appropriate PPE just to get into the hospital. So there's more risk to hospital staff becoming exposed in the community than actually at work. It happens at work because people are working hard and it's highly contagious. But we do everything we can to mitigate that.
Alrighty, thank you. And one last question. The school district numbers that you gave out earlier, are those since the beginning of school or just in the past week?
Those are total numbers, so since the beginning.
Alrighty, thank you very much.
Thank you, Aaron. We'll now go to Roger Gray of KVII Channel 7. Roger, how are you this morning?
I'm good. And actually, Casie answered my question, which was about whether Labor Day and the start of school probably contributed to the spike. It seems logical. The only other question I had is sort of a general one, probably for all of the medical experts here. We all know Texas has the highest rate of uninsured folks out there. I know COVID treatment is very expensive. We've seen a lot of stories about that. And I know that uncompensated care for any medical facility is a big issue, particularly in Texas where we disband Medicaid. What we found out, though, in the statistics also that we have the largest number of healthcare workers without insurance coverage, 600,000 in the state of Texas. And really just look to see what your reaction is, particularly for all of our medical folks on the panel. Your thoughts on that?
I can start, Roger. Absolutely, your point is well taken. We do see a number of people who have limited resources, including medical insurance. I guess if anything, we've cared for a lot of these patients and used whatever means we had to help take care of them. Thankfully, the government, with some of the CARES Act, has helped us at least cover some of those costs that we incurred with some of the early patients with COVID. But yes, I mean, Texas, the patients who have limited funding or limited resource continues to be a problem before, during, and after COVID. And I think we need to continue to seek solutions to help these people get the resources they need to take care of themselves.
I guess it seems perhaps more ironic since the healthcare workers are out there on the front line dealing with, as you've mentioned, so many staff members being exposed.
Yes, it is ironic, and I think it needs to be studied further I think a great retrospective study would be to look at various factors, including a person's charity status, their gender, their race, maybe their zip code. We have a lot of that information that can be mined out of the hospital records and at the health department. And I think that's a worthy study that I've actually been looking at.
Okay. All right.
So the just one point of clarification, the drive-through testing does remain free of charge. So we certainly take that into consideration with not only location, we want to make it as accessible as possible, but also with cost. So the drive-through testing is free of charge.
Indeed. Excellent. Thank you, guys. Appreciate it.
Thank you, Roger. Let me just conclude. I want to go back to the city manager, Jared Miller, if he could give us maybe a brief update on economic assistance grants for related to COVID-19. Mr. Miller, if you can just give us some information on that real quick.
Yeah, sure, I can do that. We've got 2 grants primarily that we're working with right now. There's a $10,000 grant for small businesses here in the city. It's funded up to $550,000 total. Of that, we've got 47 funded with 8 pending, and that represents $523,500 of the available $550,000. So we still have an additional $26,500 remaining to grant. So we've had a lot of businesses take advantage of that. So when I say that, I mean 55 businesses have submitted applications and are with 8 of those 55 still in a pending status as their applications are reviewed. With regard to the PPE reimbursement program, we've had 75 applications and we funded $148,775. So a significant amount of money has been allocated to different economic development and PPE assistance grants inside the city of Amarillo.
Thank you, Jared. That's a great asset out there for the community. That was all the questions we had from the media for today. This concludes our weekly Wednesday news conference for the latest in COVID-19 information. Once again, we do these every Wednesday at 11 a.m. I want to thank all of our panel members who took the time to provide this information to the community today. We will see everyone next week, and thank you for attending. Thank you.
Thank you.